All right, so with that, we'll go ahead and get started. I want to welcome everyone. It's great to see some new folks here today. I want to welcome you to our next presentation in our All About Alzheimer's or All About ALZ monthly series, where we really work hard to bring you useful information that you can take back with you to your support groups, your respite groups, or those that you might be caring for in your family or your social support system. It is always a pleasure to be here with you. For those who are new to our group today, or if you're listening to this recording later on, my name is Joan Asseff, and I'm a licensed clinical social worker here in the state of Texas. And I've spent most of my career working with older adults and folks with disabilities and their caregivers and care partners in a wide array of settings, including skilled nursing, hospice, home health, psychiatric care, and private clinical practice. And I now teach social work practice at the Steve Hicks School of Social Work here at UT Austin. And I welcome you to reach out if I can be a resource to any of you around the work that you're doing in the community. So today we want to bring you this presentation on sharing a dementia diagnosis with family and friends. And I hope that there will be some really useful information for you to take back. And then we welcome discussion at the end of the presentation today. So just a quick note about Alzheimer's Texas before we get started. I'm sure many of you are aware that Alzheimer's Texas is an independent local nonprofit that used to be known as Alzheimer's Association, the Alzheimer's Association Capital of Texas chapter. They have been a privately funded voluntary health organization since 1982, serving Central Texans with Alzheimer's disease and other dementias and their caregivers. About 3-4 years ago, Alzheimer's Texas broke away to form their own nonprofit and decided to focus 100% of their funds and efforts here in Central Texas. However, they maintain the same level of commitment to providing support, education, and advocacy for those affected by Alzheimer's disease in our community. So I'd like to just briefly go over the learning objectives for our time together today. We want to understand or better understand stressors and factors to consider before sharing a dementia diagnosis with family members, friends, and acquaintances. We also want to identify validating and meaningful ways for both people living with dementia and their loved ones to share a dementia diagnosis with others. And we also are striving to learn how to address potential challenges that might arise when sharing a dementia diagnosis. And we know that it can be a very vulnerable and complex process. And then as always, we want to think about and share ways that we can apply and educate others about this process. So those are our overall goals for today. So before we identify specific strategies to help people living with dementia and their loved ones share a dementia diagnosis, it's important to consider the experience of receiving the diagnosis itself. As most of us recognize, receiving any medical diagnosis is often a shock, or at the very least, unsettling and concerning. Even if we feel certain that there is a health problem and we are expecting the diagnosis, it can still feel like a shock to us. The person being diagnosed and the people in their immediate social support system can feel anger, fear, confusion, and or denial, or any combination of those feelings. Receiving a dementia diagnosis is no different. And I think that's important to remember that it can feel much like receiving a different type of diagnosis in that there can be lots of feelings that come up and lots of thoughts that come up. Many questions and emotions arise for both the person who receives the diagnosis and their social support system or loved ones. Questions like, when should I tell others about my diagnosis? How much should I share? What will other people think? What will other people do? These are just examples of questions and thoughts that might come up for both the person who's been diagnosed and their loved ones. Often the person receiving the diagnosis feels vulnerable, of course, that's no surprise. and in need of reassurance and support. They usually look to the closest people to them, family and friends. It's important to remember that there's no correct or a proper or appropriate way to feel when hearing the news of being diagnosed with dementia. Everybody feels and reacts differently, both emotionally and in the processing of the information itself. After the diagnosis, or after receiving the diagnosis, it's a very individual and personal decision to make about who to share this information with and when. Again, there's no right or wrong way. Some people might want time to adjust and come to terms with a diagnosis before telling other people. Alternatively, some people might have a reason to tell people more quickly, for example, to receive support and to make plans regarding care needs. Despite the challenging feelings and thoughts that often come up, some people living with dementia and or their family members may even feel a sense of relief at receiving a diagnosis and finally understanding more about symptoms they've been experiencing or noticing. Again, the experience of diagnosis and the decision to tell others are really unique to each person. So there's no rule book to follow as we consider how to share this information. As I mentioned before, family members, friends, coworkers, and even acquaintances may have a wide range of reactions to hearing about someone's dementia diagnosis. In addition to reactions of fear, concern, anger, or even relief at finally having a diagnosis, some family members and friends may react with denial or by expressing misconceptions they have about the diagnosis. It's not uncommon upon sharing a diagnosis to hear comments from well-meaning family and friends that indicate their lack of acceptance and or understanding, such as comments like, "But you seem to be fine," or "You're too young to have dementia." It's important to remember that stigma or misconceptions about dementia may exist due to a lack of information or a lack of ability to cope with the information that they've just heard about or that's been shared with them. These reactions reflect the person's need or potential need for more time or education before they can respond in helpful or meaningful ways. Family or friends may need time to process this news so everyone can decide how to move forward together in a meaningful and hopefully positive way. So recognizing that the diagnosis itself is often difficult, and a life-changing experience for both the person receiving it and their family, it's important to consider ways in which the person receiving the diagnosis can have as much agency as possible around how and when they share this news. As I mentioned before, there are no hard and fast rules regarding how to tell friends and family. No one should feel rushed to tell others unless they feel that urgency for their own personal reasons, as I mentioned before. Some people choose to not tell anyone about their dementia diagnosis for many months. Some people tell others gradually as they see them, and others tell everyone right away. When considering who they should tell first, it can be helpful for the person to start by telling the people they feel closest to. When considering how to share the diagnosis, many people choose to tell people face-to-face, by phone, or virtually. Some people also choose to share the news in letters, in email, and or through social media. Some people might also ask someone close to them to share the information, to share the diagnosis, if they just simply don't want to have the potentially difficult conversation themselves, or if they are truly unable because their disease process is progressing, they truly are unable to share the information, then they may ask someone closest to them to help them. Again, the most important variable in this decision-making process is giving the person who has received the diagnosis as much choice and agency around who they share the diagnosis with, how they share it with them, and when they tell them. I recognize that some people are diagnosed with dementia in later stages and may have less opportunity, of course, or ability or capacity to share their diagnosis. However, to the greatest extent possible, we want to foster agency and control around and with the person sharing the news. I found this really helpful chart that supports the empowerment of people receiving a dementia diagnosis and their loved ones, and helps them think about and make a plan for sharing the diagnosis news with others. This chart is from a site called Forward with Dementia, and this specific chart is called Circle of Friends. That's the title that they give it, and it can help families plan for the discussions they want to have about a dementia diagnosis. Each circle, as you can see here, represents a level of closeness or engagement with the person receiving the diagnosis, such as one circle that represents the partner or immediate family, and then another circle that represents close family and friends, and then friends and extended family, and then finally professionals and acquaintances. By dividing family and friends into these categories or groups, the person can decide if they are ready to inform each group, when they are ready to do so, and how they might want to inform each specific group. I have a link to this resource at the end of the presentation, the materials that'll be posted on the Alzheimer's Texas website if anybody would like to access it. And I thought it was a really helpful tool and very empowering for those who might like to really make a concrete plan around how they want to share the information with others. While we recognize how sharing a dementia diagnosis can be really difficult on many levels, it's also important to consider how sharing this diagnosis can also be more positive and empowering when approached from meaningful ways and with support from family members and friends. Again, a key part of making the process more positive and empowering is making sure, to the extent possible, the person living with dementia has as much control over who they share the diagnosis with, how they tell them, and when they tell them. They should also be empowered to share how they would like to be supported, and to be able to give specific examples, such as, I would like to continue receiving invitations to our book club, and other specific requests like that. Many friends and family are well-intentioned, but they do not always know how to support people living with dementia in the ways that they'd like, in the ways that would be affirming to them. It may help everyone if family and friends are told how the person with dementia would like to be supported overall. And it's also important for people living with dementia to feel comfortable sharing the ways they do not want to be supported. It can be helpful to provide time and actively listen to these preferences as the person with dementia is able to express them. Some people who have been diagnosed can feel that care partners are potentially being overprotective or that they are doing too much for them. And it can be disempowering if they're not given the opportunity to express these concerns. As I mentioned before, sharing the diagnosis is not always a totally negative or challenging experience. Some people living with dementia find that sharing the diagnosis can be partly a positive experience. Sharing the diagnosis can help friends and families understand what the person's going through and how they can be best supported. Finally, sharing educational materials and resources about the specific dementia diagnosis can also be empowering for the person who has been diagnosed. The more people that learn about the diagnosis, the more comfortable they may feel around the person living with dementia. And the person with the diagnosis has the opportunity to educate and share their experiences with others, which can be very meaningful if, again, they are at a stage in the disease process where they're still able to do so. Here is some sample language to help us conceptualize how a person who has been diagnosed can share how they would and would not like to be supported. As you see here, a person living with dementia could share statements like, I am still the same person as before, please talk to me in the same way. Or if I'm a little slow or forgetful, please give me time. I prefer you don't correct me. I usually get there at my own speed. While it might be a bit uncomfortable for caregivers and family members to hear some of these statements, it's important for the person living with dementia to be empowered to share what isn't working for them in the caregiver relationship. For example, a person might need to say, I sometimes feel a little useless because you do so much for me. Can I keep doing the shopping even though I may forget things? For those of us working with family members and caregivers, we can help normalize these types of conversations and emphasize that they are an important part of the coping process for the person living with dementia, especially people in the earlier stages of the disease process who are very aware of their life circumstances and of the changes they are going through. I also want to take a little bit of time to describe some strategies and best practices for speaking with children about a dementia diagnosis. Often the needs of children in this experience can be overlooked or minimized, which can lead to increased confusion and emotional distress for children and potentially other family members. When speaking to children about a dementia diagnosis, it's important to consider the child's age, developmental stage, and relationship to the person who has been diagnosed. Adapting the information to the age of the child can help increase their understanding and reduce the likelihood of miscommunication. For younger children, concrete, simple language is best, since they often have not fully developed the capacity for abstract thinking. So for example, it's better to say something like, grandma is having difficulty remembering due to changes in her brain, rather than grandma gets lost in her thoughts. That second statement is much more abstract and could cause confusion for especially a younger child. When having these conversations with children, we want to make time for and invite them to ask any questions. And we want to answer those questions simply and honestly. As with adults, it's important to explain that sadness and anger are normal reactions and invite children to share their emotions. We also want to share any immediate or expected changes a child might see in their loved one and discuss how these changes might impact the family as a whole. Some older children might have a harder time accepting the changes dementia can cause and might feel uncomfortable spending time with the person who has been diagnosed. And this can be because they've had a longer relationship with the person and they may have more difficulty coping with these changes. Again, it's important to provide time and opportunity for them to talk honestly about their concerns and feelings. It can also be very helpful to provide age-appropriate reading materials or online resources to help increase the child's understanding of the diagnosis. And I've listed a couple of good resources here, but of course there are many online and hard copy resources available for both free and for purchase as well. So I'd like to end today's presentation with some concrete tips for caregivers and family members who might find themselves in the position of sharing the news of their loved one's dementia diagnosis. Back to the recurring theme of this presentation, I feel like I've said it about 5 times, but it's really, really important. It's best if caregivers discuss how the person with dementia wants to handle the situation? How do they want to give this information? And get their permission before sharing the information, if at all possible. As caregivers and family members prepare for these conversations, it's important to be ready to explain the specific disease process and its effects. For example, if the person has been given a tentative diagnosis of Alzheimer's disease, then caregivers and family members should expect that others will have questions about what stage of the disease process the person is in and which symptoms they are exhibiting. While caregivers and family members don't have to answer these questions, and I want to be clear about that, it's really not that family members and friends need to show up prepared to answer these questions. It's good to be emotionally prepared for the fact that many people will ask these questions and decide as a family or individually as the caregiver how you want to respond to these questions. Do you want to let others know that you need more time to get back with them, or do you want to invite them to find out their own information about the diagnosis through research, and that the caregiver will share information later? Basically asking folks to, provide privacy and time for the caregiver to decide when they're ready to answer those kinds of questions. Many caregivers and family members won't be interested in and won't feel up to educating others about the diagnosis. But again, they can provide folks with and point them in the direction of educational materials from various organizations, such as Alzheimer's Texas and others, and online resources. So again, I really want to emphasize that caregivers don't have to show up to these conversations ready to educate everyone else. They can have resources ready to kind of point people in the right direction, or not. They can say, it's really up to everyone to kind of do their own research. All right, it's not, again, the family member's responsibility or the caregiver's responsibility to provide a lot of education and resources, but one helpful tactic can be connecting people with a support group, or encouraging them to access a support group if they're having a really hard time around receiving the information or difficulty coping. That's another supportive recommendation that a caregiver can have, but they don't have to show up with support groups, readily available to provide to others. They can encourage others to access that information on their own. Again, it can be very empowering to tell family and friends how they can help and what you don't want or need, right? Both of those realities, what would be really helpful and what would not. For example, people might think that it's a great idea to start bringing food to the family's home as a form of support. And I think many of us have experienced that during health challenges where maybe a food train is started and people really want to provide you with that nutritional support. But that could actually create more stress for some families who have a specialized diet or simply can't eat that much food. Sometimes you're talking about a couple living, just two folks living together, living, alone, and they simply could be overwhelmed by something like a food train and all of the food coming in. So when caregivers make their specific needs known, it can streamline the support provided by those who are eager to help with a wide range of needs. So again, it can be really meaningful and helpful to take some time prior to sharing the news with others about the diagnosis to think about what are those concrete needs that caregivers would like to share with others, so that when folks are ready to help and they want to plug in concrete ways, that the ways they give back and contribute to the family or to the person who's been diagnosed are especially helpful and especially meaningful. Another vital piece of information to share with others is an explanation of what the person living with dementia can still do safely and how much they understand when communicating. Caregivers might offer suggestions for interacting with the person who has been diagnosed, such as asking people to briefly reintroduce themselves and asking people to avoid correcting the person if they forget something. And as you can see here, I have an example around making eye contact and providing a greeting and context, such as "we used to work together." These strategies can be really helpful, and again, avoid any type of shaming or negative experience that might otherwise occur without this kind of prompt or information. As we know, some family and friends might also have trouble just simply handling the diagnosis. And this is really to be expected for some family members and friends. They might be experiencing denial, as I mentioned earlier, around the diagnosis, and or they may have misconceptions about dementia or simply feel uncomfortable. Despite even the caregiver's best attempts to help with all of these strategies, those realities may still occur, or those experiences may still occur. So due to this possibility, it's vital for caregivers to have a self-care plan for after they share this information, after they share the diagnosis. For example, if a caregiver or family member plans on sharing this information with their faith community, for example, during weekly services, then that person could ask themselves, how am I going to take care of myself after sharing this information? Maybe the caregiver plans on spending time in nature, exercising, or doing something to make sure they tend to their own emotional needs after sharing what can be very challenging news with people in their social support network. So again, it's really important to be very intentional around a plan, knowing that sharing this information is going to be challenging. I also want to recognize that sometimes we can't make a plan, and sometimes we find ourselves sharing this information during a time that is unexpected, when we really feel like we need to tell someone, but we didn't have the opportunity to make a plan. And again, in those scenarios, self-care is really, really important. And then also asking, even in the moment, for what you need in the moment and for what you would like to be avoided, what you would like people to not do in that moment. If the caregiver finds themselves especially vulnerable around sharing the news, and just using that authentic language, letting people know that this is difficult, if it is difficult, or that you're having a challenging time sharing the news. Being authentic with others around the experience can be really helpful, so they understand exactly what you're going through and how to best support the caregiver in that moment. All right, so that's the end of our presentation for today.